sign that you can obtain from a patient, that if they know that you're taking their breaths per minute, they can actually alter that. They can hold their breath, they can breathe deeper, not so deep, maybe breathe even faster. So this is one of those vital signs that we have to be really careful not to lead the patient on to knowing that this is what we're doing. So one trick is to take a pulse for 60 seconds, and after you complete that 60-second pulse, or a 30-second pulse, then you want to remember to keep your fingers on the pulse. So you're going to finish that 60-second or that 30-second pulse. Let's say you end up with 66 beats per minute on a 60-second pulse rate. Burn that number, that 66 number, in your mind, because what we're going to do is we're going to keep our fingers on the pulse as we now begin counting breaths. The patient will think that we're still taking a pulse, but we're actually now counting breaths. Remember, we're going to be standing next to the patient. As we're standing next to the patient, we keep our hand on their pulse, but continue to watch beyond the pulse over to the chest. So we're going to watch the chest expand and relax, expand and relax. And this can be kind of tricky, but because some people breathe very shallow. But standing over the patient, keeping your fingers on their pulse, I want to really emphasize that. You don't take your finger off their pulse after you take a pulse rate. You keep your fingers on the pulse, burn that number, but then transition to watching for breathing. We're going to watch the patient take a breath in. The lungs will expand the chest, and then we're going to watch them exhale, and the lungs will return to their normal size. So it'll look something like this. That would be one respiratory cycle, or one respiration, where they breathe in and breathe out. That would be one. And we're going to count the number of in, out per minute. So keeping your finger on the pulse, you're going to watch them breathe in, breathe out. And as you're standing next to them, you're going to see the chest expand and relax. It's important that, again, you do this in a way that the patient doesn't know you're counting their breaths. Now, with one hand, you can actually place it on, keep it placed on the radial pulse. Take the other hand and place it on their back. So you're just going to simply place the other hand on their back. Now, the reason we do that is because patients who breathe very shallow, you might have a hard time seeing the chest rise and lower, rise and lower. But if you put your hand on their back gently, just put your hand right in the middle of their back, you can start to feel the movement of their chest from that breath. And that's just one little extra help so that you are counting correctly. So remember, we're going to keep our hand on the pulse so the patient thinks we're still taking a pulse rate. We're then going to place our other hand on their back, and we're going to begin counting on the clock for 60 seconds how many breaths they breathe in and out. So remember, one breath is a total of breathing in and breathing out. That's one. Breathing in and breathing out, that's two. Breathing in and breathing out, that's three. We're going to do the number of that per 60 seconds. Now, you can also do a 30-second pulse, a 30-second respiratory rate, how many breaths they completed in 30 seconds, and then multiply that by 2. And that's perfectly fine. Okay? If you're really having trouble with this, I think it's important that you position yourself to the patient's side, that you put that other hand on their back, and that you really focus on that subtle movement. Some people breathe very shallow, other people breathe very deep. If they breathe deep, it's real easy to see the in and out, in and out. But if they breathe very soft, very shallow, you might have difficulty. So this really takes some effort. After 60 seconds, you're going to burn that number in your head. So remember, you're still remembering how many pulse rates or pulses you felt in 60 seconds. And now you have to remember how many respirations completed in 60 seconds. When you're done, you'll just sit down and write those two numbers, all right?
And how would you recommend that students practice this?
It's a good thing to practice this at home on someone else. Practice on patients of varying ages, so different young, maybe middle age, and even children.
So their family, their friends
family
at
members,
home.
friends, each other in class or after class. Maybe it's a good thing to do this as often as you can. In the class, in lab, we kind of expect you to do this quickly. In the beginning, you may not be so fast, but as time goes on in class, we want you to pick up your speed, but we don't want you to sacrifice accuracy. And the only way to pick up your speed is to do it more often. A lot of practice. Practice makes perfect. All right, thank you very much.